and it is the apoptosis. These are the topics of discussion, and I think you may have gone through books and acquired some knowledge regarding this. We should first describe something about apoptosis. Apoptosis is the programmed cell death. Programmed cell death. And it is important in the growth and development, and in the adults it helps to get rid of redundant cells, and it is different from that of necrosis. Necrosis, that is its genes, that is the genes of the cell is responsible for its demise. Apo means that is the away. And ptosis means fall. Ptosis. Simply falling off. ये पाता जेमन झड़े जाए गाছে এটা হচ্ছে there is no inflammation, and you may call it cell suicide. In that, this is the gene of the cells are responsible for this. And necrosis is due to death of the living cells, normal cells, due to some trauma or such there, and it is associated with inflammation. And there are some cases that have both the features. In physiology, the details of necrosis is not required. This is a part of pathology. Yeah. So apoptosis is seen during development. In the central nervous system, there is a large number of neurons, and these neurons, and along with proliferation, and there is death of these neurons, extensive deaths, so that the synapse formation and the connection, intricate connections that are formed must be appropriate. Yeah. In the immunocytes or the lymphocytes, both at the bursa equivalent and also in the thymus, there is extensive proliferation. At the same time, there is parallel extensive death of the cells, spontaneous death of the cells, and so that they become immunocompetent, and they become immunocompetent, and they become unresponsive to self-antigens, so that the autoimmune disease does not occur. Yeah. And these are going on in those sites. Bursa equivalent, that is the bone marrow, and also in the thymus. For the T lymphocytes. Lymphocytes functionally are of two varieties, B lymphocyte and T lymphocytes. Now during development, there is connection between the fingers and toes, and they ultimately disappear, so that they become separate entities, and it is an example of apoptosis. In your practical life, you've seen that is the development of the frogs. It initially has the tail, tadpole, and they disappear. These are these examples of apoptosis. Numerous other examples in the adult. Suppose in the enterocytes, Within the small intestine, there are these villi, and at the tip of the cells, they are replaced by the division of the cells at the crypts of the liver cone or the basal part. They are replaced, regularly replaced. The cells that lose connection with the basement membrane and neighboring cells, they are prone to apoptosis, and normally they are slapped and they are replaced by the division of the cells at the base of the villi, continuously going on. Okay. There is a balance normally, this balance. Within the skin, the same thing is occurring. From the very superficial layer, they are removed, and from the deeper layer, there is continuous proliferation of the cells, and that making a balance. These are the examples. In post-pubertal women, that is the endometrium is lost periodically, menstrual cycle, menstruation, and it is due to withdrawal of the hormone effect. So there is periods of, there is this menstruation and blood loss, and it is an example of apoptosis. There is no inflammation in this case. So these are the examples, numerous other examples. And this is due to the action of many factors. Many factors. It may be originated within the cell by genetic programmed cell death. Programmed cell death. Whenever there is bone formation, initially there is a structure, and then some part is lost and it is replaced appropriately so that its shapes is fit for the individual bone. Apoptosis going. Now this is this, and the mechanism of action. Some are external, some are internal action. Internal, extrinsic pathway and intrinsic pathway. And extrinsic pathway, suppose in response to some chemical stimuli like cortisol, glucocorticoid, it is responsible for the apoptosis of the lymphocytes and eosinophils also. And also there are some factors, extraneous factors that may have some effect, like tumor necrosis factor, Fas ligand also. And in that case, there is activation of whenever there is activation of the extrinsic pathway, then there is some, suppose tumor necrosis factor or Fas ligand. And in some texts, you will find some confusing whether, and it is the Fas is a membrane protein that unites with it, unite with this, and they form trimeric complexes. But in some books, when you read, then it will be confused where they are, whether it is FASL here or there, this confusion. But commonly text will be explained in this way. There is the trimeric forms. Trimeric form of the ligand. Suppose this ligand and it connects with this Fas, trimeric structures. And when they are formed, they are united with the adapter protein, FADD. Fas associated proteins with death domain, FADD. And that is activates some precursor proteins. Normally within the cells, normal cells, they are the proteins and they are in the pro form, and they requires activation so that they do have their effect. Clear? And they are called initiator caspases. The enzymes ultimately they are caspases. CAS PAC, caspase enzymes. They normally remain in the pro form, and they requires activation to have their effect. Similar to blood clotting protein, they are in the pro form and they requires activation by cleaving of some part or so in this way. And in this case, and it is responsible for the activation of some procaspase 8. Procaspase 8 to caspase 8. It is the initiator protein, and it activates then other caspases. That is the effector caspases. Caspases means cysteine proteases. Cysteine proteases. They have their active. You are familiar with the serine proteases, which have serine at this active part of the enzyme. Similarly, it contains cysteine, sulfur-containing amino acid. You remember their structure. Cysteine proteases, and it activates cleavage that contain aspartate groups. Aspartate, N-terminal end, and then cysteine, and in this case, they somehow can cleave in this way. So they are called caspases, cysteine proteases. They are of different types. There are numbers. In a textbook, say 11 types in the human being. It may be more than 11 types or more. The idea is that different types of caspases. Some are initiator caspases and some are final or the effector caspases. That is responsible for their effect. Suppose when this caspase is formed, it will activate procaspase 3, 6, 10 to active forms. And when they are produced, and these active forms, then they will have their effect upon the proteins. Some of them may activate the DNases. When they activate the proteins that have their effect upon the cytoskeletal proteins. If the cytoskeletal proteins are damaged, like gelsolin that binds the actin filaments or microfilaments, gelsolin is removed, and then the actin filaments will be divided into parts. So the structure of the cell will disappear normal. It will shrink. Structural proteins are responsible for the maintenance of its shape and size, and if the structural proteins are damaged, then what will take place in? Then it will shrink. Suppose it is a normal cell. A normal cell, it contains the nucleus and mitochondria also in this normal cell, and other organelles like endoplasmic reticulum also. Now, whenever there is activation of these caspases, then what occurs? Then it will undergo shrinkage. The cell membrane remain intact, and it will shrink. And there is the DNA fragmentation is there, and condensation of the DNA, especially at the periphery. Condensation of the DNA, fragmentation and condensation, and ultimately fragmentation of the DNA. DNases are activated, And then there is this reduction in this shape of this organelles, and reduction of the cell it will shrink. Cell membrane and the organelle membranes, they remain intact, but there is shrinking due to disruption of the structural proteins, actin filaments also. And then there is the membrane bleb formation. That is, in this case, then there is membrane bleb formation, and there is disintegration of the nucleus ultimately, and these organelles, they become dense. Cytoplasm is also dense during staining process. There is no disruption of the organelles, and they form ultimately apoptotic bodies. Membrane bulb, they are formed, and ultimately they divide into different types of apoptotic. Some may contain nuclear element, some contains mitochondria or other organelles, and they will have this type of appearance, apoptotic bodies, and they are engulfed by the phagocytes or neighboring cells, and there is no leakage of mitochondrial or other proteins in the outside, lysosomal protein in the outside, and there is no, in this case, there is no inflammation. And in this way, they disappear. So in some cases, it is difficult to detect that what is occurring. If it is a quick process, as there is no inflammation, and so the exact site in histological stain, it may. And there are crosstalk between these two pathways within the mitochondria, and you can all remember that within the mitochondria there is the outer membrane and then inner membrane, and outer membrane is much more permeable than the inner membrane, and there is cytochrome C within this space, outer membrane and inner membrane. And there are normally some proteins that are linked to, they are called BCL. BCL means B-cell lymphoma or leukemia. Some are pro-apoptotic, some are anti-apoptotic. Suppose if there is radiation or DNA damage due to some reason, DNA may come from mitochondria also. So there is link between these two pathways, intrinsic and extrinsic pathways. Now in this case, there is increase by some BCL proteins like BCL2, BCLXL, and in this way, and they are anti-apoptotic. But there are BAX, that is the B lymphocyte, this homologue of X variety, or BAD. The full form is not written in all these books, and they are apoptotic. It is anti-apoptotic, and it is the pro-apoptotic. And these are there. Whenever this damage is there, and what occurs, then there is increase in the permeability. Normally you know that the outer membrane is more permeable, but the inner membrane is not so much permeable, it is selective, and they contain different types of carriers also, and they do their effect. But in that case, whenever there is apoptosis due to some radiation, some chemicals, hypoxia is there, and in that case, then there is increased production of these proteins. If you go to pathology books or so, and in that case, you some detail, but complete understanding is very difficult. And they in some way increases this transport of some elements from this inner to outer, and ultimately cytochrome C come into the cytosol. Cytochrome C come into the cytosol. Cytochrome C normally that is present in between the outer membrane and inner membrane, and it then unite with some apoptotic proteins like APAF. APAF1 or so. Apoptotic protein activating factor 1, and it will combine with it, and in this way they become activated. They become activated and they form a wheel-like structure having 7 spines in that. চক্রের মতন একটা তৈরি হয়, wheel-like structure. Wheel-like structures, and they form a wheel-like structures. Wheel-like structures. এক, দুই, তিন, চার, পাঁচ। Wheel-like structures, and they are responsible for activating the caspases. Here the procaspase is procaspase 9. Procaspase 9. Caspase 9. And it becomes converted by this to caspase 9. Caspase 9. And it will activate, it is the initiator caspase in this pattern, and it will activate the same type of, that is the activates 3, 6, 10 or so. You can go through book and have complete knowledge. My memory is to some extent not sufficient that I remember everything. Only the basic concept I can deliver. And in this way this occurs. Now anti-apoptotic proteins, they normally prevent, they somehow, they may bind with cytochrome C, or they do not allow the pore to be formed, or they are transported through this outside membrane. And within the cytosol, there are some inhibitors that are present, and within these mitochondria also some inhibitors that normally inhibits this process. And they have different names like suppose SMAC, DIABLO. It may be single protein, or in some tests they consider as separate proteins. The basic is that they will inhibit the formation of this type of complexes, inhibit this process. There are, there are some inhibitory proteins that will help to disallow this type of activities, and they will combine with and they remove the inhibition, so that this procaspase 9 is converted into caspase 9. Normally there is the inhibitory proteins, and these inhibitory proteins disallow the formation of the cytochrome C when it comes out into this APAF1C, and these inhibitors are inhibited by this SMAC or DAB, directly inhibiting apoptotic binding, and in this way there is a full form with low PL, PI, or it is written in the book. That is the main idea that this cytochrome C plus APAP1 that ultimately produce this type of apoptosome or this, and it is prevented by some inhibitors, APIF or so, and this inhibitor is removed by this DAB or SMAC. So that at the same time there is procaspase activity with the help of BAX, BAD or so. At the same time there is the inhibition of the inhibitors. So that ultimately there is easy formation of the caspase 9 from procaspase 9, and caspase 9 then causes this, caspase 9 then causes the activation of this, that is the terminal or the effective caspases, and the process is the same. This what occurs? There is the proteinases are activated, 16 proteinases or caspases, and that causes the breakdown of some proteins, structural proteins mainly. So there is shrinking of the cell, and along with there is activation of the DNAs, and there is condensation of the cytoplasm and the chromatin, and they are seen more at the periphery. But the membranes are not disrupted. So lysosomes is reduced in the size, but its contents are not coming out. The membrane remains intact, and then there is membrane bleb formation, and then disintegration of the cells, and they form small bodies that are surrounded by membrane, and they contain different types of, there is the material. It may be nuclear material, it may be other parts of organelles, and they remain intact, and they are taken by the phagocytes or neighboring cells, and in this way the cells are removed. So the cells are affected individually or in groups or clusters. And what is the difference from the necrosis? Whenever there is necrosis, there is some trauma, physical trauma or chemical or any form of trauma, and in that case from the normal cell, and then there is the membrane becomes affected, and there is swelling of the cells. There is the nucleus, it will swell, and mitochondria, it will swell, and gradually there is disintegration of the structures, and they become extremely eosinophilic, and lysosomal enzymes also they will come out, and there is inflammation. In that sense, there is an increase in the blood circulation, and there are other features of inflammation going on. And this disruption of this, there is this chromatin is also there, but in that it is a relatively homogeneous process. The chromatin, and here there is cell becomes, there is the shrinkage, but here there is dilatation, and this chromatin, there is the degradation, they are relatively homogeneous, and their electrophoretic spread is also more homogeneous, and ultimately the lysosomal enzymes will come into the neighboring cells within the interstitium, and they will affect other cells, and there is genesis of inflammation. Inflammation means inflammatory cells will come, neutrophil, macrophage will come, and they will liberate. Full-fledged inflammation is there. But in some cases, there are some intermediate between the two. But typically, necrosis means there is the disintegration of the cell membrane, cell swelling, there is condensation, there is not condensation, and their nuclear fragmentation is more or less homogeneous than in combination, than in case of apoptosis. Clear? And it is due to the trauma. If the trauma is severe, then there is no apoptosis. And the process of apoptosis is important in that sense that either if there is increased apoptosis, then maybe disease may be found, or decreased apoptosis, disease may be found. Increased apoptosis, if there is increased apoptosis, then there may be loss of some vital cells, as in the nervous system. There may be development of the Alzheimer's disease, Parkinson's disease, or so, this type of disease can develop. Some motor neuron disease can develop. There is no inflammation, and only the cells of particular area are being destroyed. It is due to some effect also. Withdrawal of the growth factors, or so in this case. RBCs, there may be there is a hemolytic anemias, thrombocytopenias, and it is due to, it is abnormal. On the other hand, whenever this apoptosis is required is not there, then there is every chance of development of the tumor, cancer formation. Cancer formations. Cancer formations. And in that case, there is an important protein is P53 and P53 gene. P53 gene. It is related to apoptosis. P53. P53. And it is, function is less in some cases of cancer. Good number of cancer where there is less action of these proteins. And it is a gene present in the chromosome number 17. And these proteins, normally it protects. But whenever the situation is beyond control, then it becomes, normally it tries to restore the normalcy. But if this trauma is more, then there is full-fledged apoptosis is there. P53. 53 means that is the molecular weight is 53,000. Molecular mass is 53 kilodalton. Molecular mass kilodalton. Molecular mass weight. It can act directly, or it is a transcription factor. It will activate other genes to produce some products, and they have action of the on the cell cycle phases. Within the cell cycle, you can remember there is the mitosis is followed by G1 or gap 1 phase. You can remember that is this. Whenever there is cell cycle, then there is ultimately mitosis, M phase. M phase is followed by G1 phase, gap 1 phase. And then there is the synthetic phase, synthesis, when the active synthesis of DNA and other elements are produced. And then there is another G2 phase, gap 2 phase, and then mitosis. In this way, cycle repeats. And there are some cyclins and cyclin dependent kinases are produced. And this P53 induced protein of 21 kilodalton, that is another protein, and it has some effect upon these kinases, that is this, that regulate the cell cycle, so that the process is delayed and the repair system of the cell has time to detect and rectify the defect, if the defect is small. But if the defect is more, and in that case there is activation in the other way, the apoptosis, then there are activation of some genes that have their effect similar to that of the genes. There is an element that is causing this, the intrinsic pathway. Full-fledged apoptosis is there. And when this P53 gene is not functioning, mutation of these genes, so there is deficiency of this controlling protein. And if there is some defects within the DNA or mutation, then it will persist. And this mutation may lead to the excess proliferation of the cells, uncontrolled proliferation of the cells, and that causes the tumor formation. Clear? কাজে আমার যে জ্ঞান বুদ্ধিতে কুলালো যতটা আছে আমি তোমাদের এটা বললাম, এবং তোমরা যখন বই পড়বে তখন দেখবে যে বহু জায়গায় আমি হয়তো মানে আমি হয়তো এড়িয়ে গেছি, আমার মাথায় আসেনি, সেটা তোমাদের জ্ঞান বুদ্ধিতে তোমরা করে নেবে। হ্যাঁ, ইউ উইল ফিল আপ The basic concept of apoptosis is that it is a programmed cell death and it is not an inflammation and it is required for the normal development. And during, not only during development, during the adult stage, this is going on. And there are numerous examples where it is taking on. Suppose if there is removal of the testes, and in this, due to lack of testosterone, there is atrophy of the prostate gland. These are also examples of apoptosis. There is no inflammation, removal only. And in that case, gradually their number will reduce. And it has two pathways, mainly the intrinsic and extrinsic pathway. In some text, you will find another pathway, that is the direct pathway, bypassing this extrinsic pathway, granzyme pathway. And that is also to some extent they have by means of they have directly effect in this way. But normally extrinsic and intrinsic pathway started with some death receptors, and they are not only fast, they are also DR3, DR4, DR5. And they form timers with fast ligands or tumor necrosis factor receptor, TNF receptor. And there are connection between them and they form trimers. And these trimers are FAD and they have adapter proteins within the cytosol, FADD. And they causes the activation of the procaspase 8 to caspase 8, and it is the initiator caspase, and it will activate the pro forms of 3, 6, 10 or so to active caspases, and they will have their effect upon the on the structural proteins, and that causes shrinkage of the cell. There is DNA fragmentation, cytoplasmic, and the nuclear condensation, but there is no rupture of the cells, and there is ultimately membrane bleb formation, and there are and they divide into different type of apoptotic bodies, and the apoptotic bodies are taken up by the phagocytes or neighboring cells. So there is no trace, কোনো অংশ কিছুই থাকবে না, পুরোপুরি সেটা চলে যাবে. There is no inflammation. But whenever there is necrosis, then that is reverse type of activity occurs. And in that case, there is swelling of the cells and ultimately rupture of the membrane, cell membrane, also organelle membrane. Lysosomal enzymes will come and lysosomal enzymes will try to destroy neighboring tissue. There is inflammation. Inflammation leads to the capillary dilatation, extravasation of fluid also. And pattern of destruction of the nuclear material is different, and that can be detected by electrophoretic motility, and it is relatively the uniform and not step ladder fashion as in case of apoptosis. Yeah. But there are some cases that have features of both. Another is the intrinsic pathway, that is from the mitochondria. It contains cytochrome C within the space between the outer and inner membrane, and whenever there is some activity, there is DNA damage due to radiation, chemical or anything else, and in that case there is increased activity within the cells, and there is formation of this type of proteins BAX, BAD, that is the pro-apoptotic proteins that will overcome the inhibition of BCL2 and B cell XL, B cell coming from the B cell leukemia or B cell lymphoma associated proteins. And then there is liberation of cytochrome C into the cytosol, and cytochrome C will unite with this type of pro-apoptotic protein, and they form this type of structures, wheel-like structures having 7 spines, and they will activate procaspase 9 into caspase 9. And it is facilitated by proteins like SMAC or they may be separate, in some text they may single protein that causes inhibition of this inhibitor, inhibition of the inhibitors. So ultimately there is stimulation. And and this activation capillary, they also activate DNAs. So there is breakdown of this nuclear pattern, and in this way there is nuclear condensation, and the nuclear material at the periphery it is seen, and in this way it will operate. And p53 protein is related to that of this. It will control this cell division normally. And whenever there is some DNA damage, small amount of DNA damage, then p53 proteins, with the help of, it is a transcription factor, and with the help of a 21K proteins, and it causes this, there is this checksum enzyme, and then there is, to some extent, there is inhibition of the speed of the cell division process, so that this, there are some repairing mechanisms are within the system. You will find in details in biochemistry test, Harper's biochemistry or biochemistry, how they repair this system. And normally, if it is damage is less, then there is no chance of apoptosis. But when the damage is severe, so that the normal restoration, normal stage restoration is not possible. In that way, in this case, there are some activity of genes that are pro-apoptotic, and they will have this process of apoptosis that we have discussed. Formation of caspases. Caspase means cysteine proteases, and it breaks the protein after the aspartate residue. So called caspases. Cysteine proteases, they act upon the aspartate residue. So they are called caspases. Normally they are in the inactive forms, and they require activation in this way. Clear? And some may be programmed. No external stimulus is required, but external stimulus is also may be responsible. By the withdrawal of the growth factors, withdrawal of the hormones, there is the activation by cortisol. Some way they have their effect. So this is something about apoptosis. We can discuss to some extent in 1.2. There is the homeostasis. Sufficient time is there. Our cells, multicellular, we are a multicellular animal, and our cells are bathed by interstitial fluid. Interstitial fluid are part of the extracellular fluid. In young adult individual, total body water is which percent of body weight? তোমার কারণ স্মরণে আছে? 60%. Very good. 60% of the body weight is total body water, and of this 1/3 is in the extracellular fluid, and 2/3 in the intracellular fluid. And besides plasma, the remaining part is the interstitial fluid. And our cells are within the interstitial fluid. And for their proper function, there must be a fixed composition of this system. And it is maintained. Day in, day out, it is maintained to have the function of these cells. And this process by which there is the constant environment is maintained, and this is called homeostasis. Homeo means there is the like or same. Stasis means there is a stable position. Homeostasis. Stasis means there is the stable position also. Static energy, or these are, you are familiar with this type of terms. Now, homeostasis, and it is maintained, normally maintained. There are some typical examples. Normal pH of interstitial fluid or plasma, arterial plasma. What is the normal pH of the arterial plasma? Arterial plasma pH কত? হ্যাঁ, ওই কাছাকাছি চলে এসছে সব, তার মানে জ্ঞান কিছুটা তোমাদের হচ্ছে, সহজ জিনিস এগুলো কিছু নেই এতে। হ্যাঁ, 7.40, সো রেঞ্জ ইজ 7.35 to 7.45. In যে অ্যাভারেজ হচ্ছে, অ্যাভারেজ পিএইচ ইজ ইকুয়াল টু 7.40 arterial plasma, and this is the range normally. It is physiological range, and relatively wider range in which life is possible. Life is possible. যেমন 6.9, this range 6.9 to 8.0. 6.9 to 8.0. It is the range in which, if it is, life is possible, মানে কারেক্টিভ মেজার এর পক্ষে সম্ভব হবে। Normally in your medicine text you will find they express hydrogen concentration as nanomole per liter. Nanomole per liter. ন্যানোমোল, তুমি যখন মেডিসিন বই পড়বে দেখবে ন্যানোমোলে লেখা আছে, ন্যানোমোলে লেখা আছে। এখন পিএইচ থেকে ন্যানোমোলে কি করে নিতে হয়, এগুলো হচ্ছে তোমার স্কুল লেভেলের বিদ্যা, এগুলো তোমাদের একটু জানতে হবে, বুঝতে পেরেছো? সামান্য একটু জানা থাকা দরকার, নাহলে পরে একটু অসুবিধা হয়। তবে করতে হবে কি, তোমার এটা হচ্ছে পিএইচ থেকে এটাকে ন্যানোমোল পার লিটার করতে হলে পরে অ্যান্টিলগ 9 - পিএইচ, এটা করলে পরে যে ভ্যালুটা পাবে সেটা হচ্ছে ন্যানোমোলে পাবে, ন্যানোমোলে কনসেন্ট্রেশনটা পাবে, অ্যান্ড ইট করসপন্ডস টু 40 ন্যানোমোল, 40 ন্যানোমোল। বুঝতে পেরেছো? এই কী করে অ্যান্টিলগ 9 - পিএইচ আসে সেটা নিজেরা বাড়িতে বোঝার চেষ্টা করবে। যদি এটা করতে না পারো তাহলে পরে নিজেরই দুঃখিত হওয়া উচিত যে আমার হায়ার সেকেন্ডারি পাস করেছি, আমি এটা এত মেধাবী লোক, অথচ এই সামান্য জিনিসটা করতে পারছি না। তখন যদি তোমার ইচ্ছা হয় তো তুমি আমাদের সঙ্গে দেখা করতে পারো। হ্যাঁ, এইগুলো হচ্ছে তোমাদের সহজ জিনিস, এগুলো পারলে ভাববে না, সেই তখন এরকম যে না আমার মস্তিষ্ক ঠিকমতো কাজ করছে, হ্যাঁ সেই এটা তুমি বুঝতে পারবে, হায়ার ফাংশন তোমার কাজ করছে ঠিকমতো, বুঝলে? এটা তোমার উপর ছেড়ে দিলাম কি করে এইটা ডিরাইভড হয়। মানে আমাদের our principal idea is that this is maintained, and this range is not much more, and there is every scope of the body to maintain it very close to this. It is the extracellular fluid. In the intercellular fluid it is 7.20, and it is maintained relatively strictly with the help of some organs like respiratory system, kidney, respiratory system, blood, to some extent GI system is also responsible. These are by means of which there are some buffers, and the buffers are responsible to maintain this, to control acidosis and alkalosis. So homeostasis is maintained. Similarly, there are other variables that can go array, and it is normally brought back to normal. And for this purpose there are the feedback systems, and feedback systems, there is a negative feedback system, feedback it is, and to some extent positive feedback in some system, positive feedback. This is responsible for this homeostasis, and there is a feed forward. There is another system, feed forward system. Feed forward system. In anticipation. Yeah. Negative feedback system, so that there are some normalcy, there are some set point, and there are some sensors that can sense that there is some deviation. Consider the case of cortisol. cortisol. It is a glucocorticoid and it is secreted from the anterior pituitary. That contains, that secretes the hormone ACTH, adrenocorticotropic hormone, and that acts upon the suprarenal gland or adrenal gland, zona fasciculata. From this cortisol is secreted. Now there is a normal range of cortisol secretion and there is the feedback, normal feedback. If there is rise in the cortisol secretion or similar compound can be given by injection or by oral route, that is this type of activity, and in that case there is negative feedback. So from the anterior pituitary, to some extent hypothalamus effect also, and in this case ACTH is secreted in less amount and their effect upon the adrenal cortex is then becomes less and less amount of cortisol is secreted, and this process continues so that the normal condition is restored. On the other hand, due to some disease or so, there is fall in the cortisol level, then part of the feedback, part of this information goes to the area pituitary, more ACTH is secreted, more ACTH is secreted, and it will try to bring that the level of cortisol to normal. It is applicable also to thyroid hormones. Iodine deficiency leads to enlargement of thyroid gland, and that's called goiter. Goiter is the enlargement of the thyroid gland. Whenever there is iodine deficiency in some areas, and then there is less amount of thyroxine or triiodothyronine is produced, and in response to this there is increased TSH from the anterior pituitary, and it will chronically act on the thyroid gland. So it will try to maintain to some extent at the borderline level, normal borderline level, but at the expense there is increase in the proliferation. Hyperplasia, when the number of cells increase, it is called hyperplasia, and when the individual cells enlarge in size, it is called hypertrophy. In some cases there may be combined effect, so that there is increase in the thyroid gland, it is called goiter. Iodine deficiency goiter. It is an example of homeostasis. Numerous other examples are there in this case of negative feedback. Calcium level of blood sugar, they are all, they can be explained. Numerous are examples. Insulin controls blood sugar. If there is normal range, and whenever normally after food intake in normal individual, during the process of digestion and absorption, there is increase in the level, there is increased secretion of insulin, and insulin makes this glucose available to the cells for their metabolism. Oxidation increases, and then storage of glucose as glycogen increases, so that the normal level is. Glucose tolerance test is an example that based upon this hemostasis, negative feedback. We have discussed about the hydrogen concentration, similarly calcium concentration also. Now positive feedback mechanism, in that case this is variable that changes and it will go on in that same direction. Physiologically maybe some important effects in some cases, physiologically, and it may be pathologically, it may be harmful in cases. Typical examples of positive feedback, that is parturition, ovulation, ovulation, action potential generation, action potential generation, phenomenon of clotting. There are other examples also. Suppose in case of action potential, if you consider, action potential is produced by the quick entry of sodium ion from extracellular fluid to the intracellular fluid in excitable tissues. You can remember their level in the extracellular fluid. What is the sodium concentration in the extracellular fluid? তোমাদের সব অনেক দিন পড়ছো, কত হয়? 0.9%. ওটা কিসের? 0.9% কি জিনিস? কোন পদার্থের 0.9%? তুমি যদি বলো 0.9% কি জিনিসটা, কোন পদার্থের? ওটা হচ্ছে তোমার সোডিয়াম ক্লোরাইড, খাদ্য লবণ, বিশুদ্ধ খাদ্য লবণ, সেখানে সোডিয়াম ক্লোরাইড এ বলেছে। বুঝতে পেরেছ? তা সেটা থেকে কনসেন্ট্রেশন থেকে বার করতে পারা যাবে না তা না, সেটা কাছাকাছি সেটা থেকে যাবে, কারণ সেটা আইসোটনিক উইথ প্লাজমা, তাই সেটা থেকে বার করা যাবে। 0.9% মানে হচ্ছে যে তোমার এটা হচ্ছে 0.9 গ্রাম পার ডেসিলিটার, 100 ml। কাজে তুমি এটা কত পাবে? 10 দিয়ে গুণ করলে 9 গ্রাম পার লিটার পাবে, 9 গ্রাম। 9 গ্রাম, তাহলে 9 গ্রাম থেকে তোমাকে এখানে সোডিয়ামের কনসেন্ট্রেশন বার করে নিতে হবে। এই 9 গ্রাম লিটারে যদি থাকে, তাতে সেখানে তোমার কত গ্রাম সোডিয়াম ছিল কি করে বার করবে? 9 গ্রাম সোডিয়াম ক্লোরাইডের মধ্যে কত গ্রাম সোডিয়াম আছে সেটা কি করে বার করবে? তাহলে এগুলো তো কেমিস্ট্রি, এই জন্য বিদ্যাটা হচ্ছে একটা কন্টিনিউয়াম, বুঝতে পেরেছো? এটা ছেড়ে দেওয়া যাবে না, একটা ছেড়ে আরেকটা হবে না। এই জন্য বিদ্যাকে লিমিটেড করা খুব কঠিন, যে শুধু এইটুকুই জানবো আর বাদবাকি কিছু জানবো না, সেটা অন্য ক্ষেত্রে হতে পারে, কিন্তু বিদ্যার ক্ষেত্রে তুমি একেবারে করতে পারো না। এগুলো ক্লাস 9-এ তোমরা পড়ে এসছো, তোমরা এগুলো পড়ে পাওয়া যাবে। এখন যদি বলছো 9 গ্রাম থেকে কি করে আমি বার করবো যে কতটা সোডিয়াম আছে, সেটা আমি করতে পারছি না, তাহলে সেটা তো দুঃখ পাওয়ার কথা, বুঝতে পেরেছ? খুবই দুঃখিত হওয়ার কথা। হ্যাঁ, এটা পারবে না এটা করতে? হ্যাঁ, এই যে মনে করো, এই দেখো এটা টাইম চলে যাচ্ছে, এগুলো সহজ জিনিস, এগুলো বাড়ি থেকে কিছু কিছু পড়ে নেবে, সব জিনিসই করা যায় না। এই যে তাহলে পরে এটার মধ্যে তুমি যেটা পাবে, এটা হচ্ছে 23 প্লাস 35.5, এটা তুমি পেলে। কাজে এই যে টোটাল হচ্ছে তোমার 58.5, পেলে তো? তাহলে পরে এর মধ্যে আছে কত? 23, এর মধ্যে 23 আছে সোডিয়াম। তাহলে পরে এক্ষেত্রে একের মধ্যে কত আছে? 23/58.5। 9-এর মধ্যে কত আছে? ইন্টু 9 করলে পরে তুমি পেয়ে যাবে। এবং যেটা, হ্যাঁ, তুমি যেটা পাবে এবার সেটাকে তোমার মোল হিসাবে তোমাকে করে নিতে হবে, মোল বা মিলিমোল হিসাবে পরিণত করে নিতে হবে। এইভাবে তুমি বার করে নিতে পারবে। সাধারণত তোমার মনে রাখতে হবে 140 to 150 মিলিমোল পার লিটার, বুঝতে পেরেছো? এই সেই সোডিয়াম কনসেন্ট্রেশনটা 140 to মনে করো 150 মিলিমোল পার লিটার, এবং এটাও মেনটেন করছে পার লিটার। যদি এটা ডিভিয়েশন হয়, ইফ দেয়ার ইজ ডিভিয়েশন ফ্রম দিস, ইফ ইউ টেক excess of salt, then initially there is some increase in level, but it is reduced in 2 ways, and it will draw water, so there is increase in the extracellular fluid volume, but the concentration becomes low, and there is ultimately less formation of this aldosterone, mineralocorticoid, so they will be eliminated in the urine, and in this way it is restored. ওইটা তুমি নিজে করে নেবে, এইগুলো সব করা যাবে না। হ্যাঁ, ওগুলো তোমাদের নিজেরা কিছু করবে, আমার কিছু ভুল ত্রুটিও হতে পারে। হ্যাঁ, তোমরা এখন এগুলো নিজেরা করবে, সবটা আমরা বলে দেবো সেটাই হয়। এটা বুঝতে পেরেছো তো? হ্যাঁ, এগুলো বাড়িতে চিন্তা করে তখন দেখবে, যদি তোমার না হয় তাহলে মনে লজ্জিত হওয়া উচিত, লজ্জিত হওয়া উচিত। তোমার টেক্সট বইয়ে তুমি এটা দেখবে, সেটা যদি না পারা যায়, যদি না পারা উচিত ছিল, তখন লজ্জিত হওয়া উচিত। এবং যদি সেটাতে তোমার ভিতরে মনের ভিতরে যদি ক্লেশ তৈরি হয়, তাহলে জানবে যে ইউ আর ইন দি রাইট পাথ। আর তুমি যদি দেখছো যে পারছি না, কিন্তু তোমার ভিতরে কোনো অনুভূতি হচ্ছে না, তখন বলবে ইউ আর অন দি রং পাথ। তাহলে তোমার আর কিছু হবে না ভালো। হ্যাঁ, কিন্তু তোমার জানো না, এটা পারছি না কেন, আমি আবার চেষ্টা করে দেখবো। হ্যাঁ, তখন তোমার ইউ উইল ইন দি রাইট পাথ। তোমার সন্দেহ জিজ্ঞাসা নিজে, কোনো একটা জিনিস আমি একটা প্রবলেম, আমি যখন যদি না করতে পারি, তখন মনের মধ্যে আমার খুব ক্লেশ হয়, যেটা হচ্ছে না কেন। বুঝতে পেরেছো তো? তা তুমি যখন বুঝতে পারবে, তখন তুমি না, এটা ঠিক আছে। আর এখানে ফিট ফরওয়ার্ড সিস্টেমটা ইউ হ্যাভ টু, দ্যার ইজ উইদিন 1 minute ইট ইজ পসিবল। ফিট ফরওয়ার্ড সিস্টেম, সাপোজ body temperature, we have no control of the outside temperature, but we are exposed to different types of temperature. Now in anticipation, body has some role, it is a part of negative feedback. Suppose during cold days, when the surrounding temperature is 10 degree, then we feel chilly, so that there are the sensors present in the skin and also within the body, and they will send information to the higher center like hypothalamus or so. And in response to this, there is corrective factor, corrective actions like vasoconstrictions, increased movement of the muscles, to some extent increase in the metabolism, so that the core temperature maintains more or less constant near 98 degree Fahrenheit. So in that case, it is feed forward. That is, we have no control over the extraneous, but and in anticipation too, there is no real fall in the body temperature normally. Yeah. And in some text you will find the term that is the gain, GAIN of these feedback systems. Gain means that is, you consider whenever there is no feedback system, no feedback control system, then the change, and when there were feedback system, then there is some corrective measures. In spite of corrections, there are some errors in there. Suppose if an individual is dead and kept in a water bath of 0 degree centigrade, and his core temperature will be after some time will be 0 degree centigrade. But in normal individual, if he remains within this, and then it will try to control it, and the temperature may fall after some time, suppose to 95 degree Fahrenheit or so. That may not be lethal, but it has the capacity to control it. So the correction in that case is required 0 degree to 37 degree. It is the correction that is required. And suppose it is the corrected up to 35 degree. So the error becomes 37 minus 35 is equal to 2. So then in that case, his gain is the correction divided by the error. That is the 37 divided by this 2. That is the whatever the ratio, and it is the gain of this. And in case of positive feedback system, when it is more than 1, then there is vicious cycle, and the process may lead to termination, even death some individuals. Suppose if there is gross hypotension, then cardiac function deteriorates, and further weakening of the cardiac action. And so in this way, there is reduction of this, there is the ejection fraction, and ultimately there is so much reduction, there is life is not possible. And it is the pathological. And in physiological sense, at the time of parturition, ovulation, and action potential, then it is the beneficial for the physiological effect. আজকে হয়ে গেল তোমাদের, আর 2 দিন আমরা আলোচনা করব এই 2 টপিকের। এরপরে আমরা মানে আমাদের জেনারেল ফিজিওলজি, এরপরে আমরা অন্য সিস্টেমে চলে যাব, এবং তোমরা এগুলো পড়ে নেবে, খুব সহজ জিনিস এগুলো। হ্যাঁ, আমি যে বললাম অসম্পূর্ণ রইলেও কোনো জায়গায় ত্রুটিও থাকতে পারে, সেটা তোমাদের ডিউটি হচ্ছে সেটাকে কারেক্ট করা। হয়ে গেছে।
So I will put other headings for the same topic later on, all right. You just write down for, you have to answer if it is 20 marks, that is if type A question, so there will be 20 marks for this question. And if it comes, rarely it comes in type B, that is 10 marks, then you have to squeeze the entire thing, all right. And the organization of the answer will be as it is, that is, you have to write 1 sentence to 1.5 sentence in introduction. Then classification means that just the type and the subtype, that is it's a ball and socket type of joint, that's a synovial joint with subtype ball and socket. Number 3, what is most important is the description of the articulating surfaces, all right. Number 4, ligaments of the joint. Number 5, relations. Then comes the nerve supply and arterial supply. That is the 6th point. Movements available to the joint. That is the 7th point. Mechanisms. That is the 8th point. Number 9, that is the rotator cuff syndrome and limitations. And number 10, comments. In any direction, you can take this topic. All right. In introduction, I would like to say only one thing. This is the most free joint in our body. There is no other joint that can move with such kind of 3 degree of freedom, right? Second point, the classification. Typically, this is a synovial joint, subtype is ball and socket. Write down. Take the organization at least for answering the question. Not what to what, take the organization, how to put. Now the description of the articulating surface. Here the ball is the head of the humerus is the ball and the glenoidal cavity is the socket, all right. As I have shown you, demonstrated yesterday, that the ball is quite large with its articular surface occupying 2/3 of a sphere, and it is, as I can remember, 24 millimeter square surface area, all right. And for the socket, it is only 6 millimeter square. For the socket, it is 6 millimeter square. So the socket cannot hold any larger amount of the articulating surface of the humeral head, right. This deficiency is met up with putting some fibrocartilaginous rim around the margin, that is called the glenoidal labrum, together with the fibrous capsule which is made here lax, so that the humeral head can roll freely. In most of the joints, the fibrous capsule and the synovial membrane, that is the synovial pouch, is always kept tense. Kerom thake ekta synovial membrane, ঠিক আছে, it is always tense. Here it is lax to allow some more space for rolling of the humeral head. বুঝলেন না একটা জিনিস, যদি কোনো জিনিস খুব taut হতো, ঠিক আছে, so that gives the taut effect of, that gives the cushioning effect to the any bony part. When it is lax, it is actually creating more space for the humeral head. Got it? And what is the congruent or full pack position for the shoulder joint? You know the term congruence, full pack? Don't know. All right. In the position of a joint whereby most of the articulating surfaces are in contact, that position of a joint is called full congruence or close pack. Most of the articulating surfaces are in contact, that is called full congruence of a joint position. To know the definition of flexion, extension. Have you read these things? Huh? What is the definition of flexion? One by one. Start from you. What is the definition of flexion?
To take the part of muscle and closer to the body so that the angle between body and part of muscle decreases.
You?
Flexion or extension?
Flexion a definition.
Flexion is the type of movement in which the two muscles of the body are in a close proximity and the angle between them reduces.
You?
Sir, when the flexor surfaces of two muscles of two different bones comes in close contact.
You cannot stamp two surfaces flexor without giving the definition of flexion. Is it the rule? Can you use a term for which you are defining? Can you use that term? No. Sit down. Thank you. You?
Flexion is a type of movement where there is an decrease in joint and it is often
I appeared for a forensic an interview for the forensic department. I was giving answers because I knew the things. And the officer told me they are not actually professor, assistant professor, associate professor like this. They are officers. All right, sit down. He told me, I understood, gentlemen, you know the things, but your terminology doesn't match. Your terminologies don't match. So your answer should match the terminologies. Without those things, your words are weightless. Next. During flexion is not the starting point of a definition. Sit down. Next one. Sit down. One. There is another character. Nobody is taking care of it. Sit down. The point which you are missing is it's a position of a body part or a limb by which it elaborates least space or occupies least space until and unless by moving towards the center of the central body axis. It occupies or expanses least space. When you make this thing, this is flexion, isn't it? When you make like this is flexion. So your limb or body part is either elaborating or occupying least space. That movement is flexion. Got the point? Hey, you. Did you listen? You, the black t-shirt. Yes? Repeat what is flexion. Come here, come down. Define flexion. Reverse your side. Face you. Incomplete. I don't say that it is wrong, but it's incomplete. as I have told you. You got my point? Right? What is that? You are supposed to be attentive. These words are very rich. Even I can forget at any moment. But you have to carry these words for at least 60 years. After that, what happens? That is not a matter. These words are so much rich. Arekjon repeat karo. Thank you. Sit down. Repeat, anybody.
It is a kind of movement in which the two muscles which is attached to the bone are come to a close proximity and angle between them is reduced.
The part which I told is still missing.
Position.
What is that? What is that position? It will occupy least space or elaborate least space. All right, that is the flexion movement. So, in case of shoulder joint, the position of full congruence or close pack is the lateral rotation and abduction. It is lateral rotation and abduction when it occupies highest space. It can elaborate or occupy highest amount of space. You can see it. If it is medially rotated, it comes to the body axis, central body axis. If it is laterally rotated, then it moves away from the body, right? And then if it is adducted, it comes close to the body. This is adduction for humerus. This is flexion. This is extension. All right. And this is adduction and this is abduction. All right. So in abduction, you can take or occupy maximum space, and that is the position of full congruence. Got my point? So there are introduction, number 2, classification types and subtypes. Now there is description of the articular surfaces of the humerus and articular surface of the glenoid. Then comes the ligament. Now for the purpose of ligaments, so it is a capsular ligament with the synovial membrane, the bands of the humeral ligament, just strengthening the capsule, then the coracoacromial ligament, coracohumeral ligament, then the transverse humeral ligament, among the others. Now, which ligament is important for transferring the body weight that is carried by your superior extremity to the axis? Coraco? Anybody else? Huh? All right, this is beginning. It's not important that you are making some mistake. It is not the coracoacromial. There are two, you have two choices. So if coracoacromial is not, so there is a chance of coracohumeral ligament. You have to know clearly the site of attachments of coracoacromial ligament and coracohumeral ligament, because in this area, AKD, the textbook of AKD contradicts with Samarmitra and other books. RJ last, you have seen? No. You have any copy of 38th edition of Gray's? Do you carry a Gray's anatomy with you? No. Cunningham? No. You have to keep with you at least close to your living place, your study room, at least one standard book. Otherwise, it is not possible because these areas are so much controversial and they are a debate among many points. So, if you cannot stand at few points, your confidence will be when the examiner will throw questions confusing you, you will not be able to stand erect before him or her. Bujhle ki kothata? Hey you, come down. Come down. Yes, all of you, the full group. Come down. If you have money, you can buy the diamond, but nobody will teach you how to buy a stone. Do you know? Come closer. Do you know how to buy a? Do you know how to buy a stone? Anybody? What are the characters you have to see in a stone before buying it? Whether be it a diamond or a sapphire. Come down. What my words are rich. I won't allow you to waste these words. You have no right to put my words in stray areas. Come down. Everything is written in book. So what's the use of using a teacher? Now tell me the definition of extension. What do you mean by extension? Just reverse the words and it will be defined. Tell me, come down. Stand here, facing them, yes. Face them, not me. Don't waste time. Go and sit there. Go and sit there. Don't waste time. Go and sit there. Interesting? So, which one is coracoacromial arch or coracoacromial ligament and which one is coracohumeral ligament? Their attachment sites are still controversial. So, you must follow a standard book so that you can say that I have, and you can put the name Cunningham or R.J. Last or Gray's Anatomy, 38th edition, 40, 42, whatever, so that you can give a reference to your adaptation of idea, which idea you have adapted. You can put forward a reference book name, all right. Otherwise, it will be completely wrong if you mention anything that is beyond the standards. It will be completely cut out. So, this is the coracohumeral and the coracoacromial ligament. Which one is coracohumeral and which one is coracoacromial ligament? Can you define? Konta coracoacromial, konta coracohumeral. No, draw it, come here. I will be happy. Please. Take me. Take this part. Draw it proportionally. Draw it proportionally.
This is coracoacromial ligament because it extends from coracoid process of scapula to the acromial process, and this is coracohumeral ligament which extends from greater tubercle and lesser tubercle to the acromial process of scapula.
Does it look like so, according to your diagram?
Acromial process.
No, no. Yes, all right. Good try. At least you have tried where it is or how. Let me take a little time. I will draw it along with the relations. All right. I will take the advantage of drawing the relation. Then I will draw along with this. All right. Now, where I was, coracoacromial and coracohumeral ligament. And after that, I have written transverse humeral ligament. Which one is transverse humeral ligament? The ligament that connect the top of both the tubercles, the greater and the lesser tubercle, and acts as a retinacular band for the down moving conjoint head of, or that is the long head of biceps femoris, which acts as a retinacula. What is retinacula? What is retinacula? These are fibromuscular band, part of deep fascia. It's a part of deep fascia that helps tightening the space so that the tendons, contracting tendons do not buckle out. Contracting tendons do not buckle out. মানে কি আমার এখানে এতগুলো টেন্ডন আছে, ঠিক আছে, একে রিস্ট ওয়াচের মতো যদি এরকম করে বেঁধে না রাখতাম, ঠিক আছে, তাহলে কি করে যেত, এটা বাকল করে যেত, তাই না? সো দ্যাট কন্ট্রাক্টিং ব্যান্ড or the deep fascial band with greater thickness and tensile strength is called retinacula. So it is a band, transverse humeral band is a band like a retinacula that holds the long head of biceps so that it doesn't buckle up. All right. So if you describe these 5 ligaments, now you have to give a little detail of their attachment. Where the capsular ligament is attached, glenoid cavity, sorry, head of the humerus, where head is round, all right, all these words, and right, he is right, that is at the margin of the anatomical neck, except upper part where there is a deficiency through which the long head of biceps enters into the joint, taking a slip of this synovial membrane of this joint. So biceps is intra-articular but extra-synovial, as it takes a synovial sheath around it. So it is intra-articular but extra-synovial. Got my point? So it is the, what it was? কি বলছিলাম? Capsular ligament. On the medial aspect close to the surgical neck, it sags down 1 to 1.25 centimeter, so that the capsule and the synovial membrane remains a little lax as it sagged down at the surgical neck of humerus, and behind this area there is the axillary nerve and posterior circumflex humeral artery. Exactly এই জায়গাটার পেছনে towards the anteromedial, no, there is a medial border close to the anatomical neck is the site of surgical neck, right, 1.25 centimeter below the lower end of the laser tubercle. So there is a deficiency of this capsular ligament, there is a sagging down, and just behind that there is posterior circumflex humeral artery together with axillary nerve. So if there is a trauma to the surgical neck will be fractured together with the blood vessels and the nerve. Not necessarily something is surgical neck means it will create some surgical problem, not necessarily, but here we can see as the long head of triceps, and in between the long head of triceps and the teres major, what is entering? The axillary nerve and the posterior circumflex humeral artery. So if the surgical neck is traumatized, I will draw and I will give you the relation so that you can understand this. এই পর্যন্ত থাক, পরে বাকিটা পরে এলাবোরেট করা যাবে, ঠিক আছে। এইখানে কয়েকটা ব্যান্ড এঁকে দিতে পারি। Write down, this is the acromion process. Label this diagram. Number 1, this is the acromion process. This is the other end where actually trapezius attaches. At this point, the trapezius attaches, and here that is the deltoid, the anterior fibers of deltoid, and there is trapezius. But in the plane, there is a CT plane, all right, MRI of shoulder joint. So at that plane, trapezius cannot enter. So you can see the posterior fibers of deltoid. So these are anterior fibers of deltoid, these are posterior fiber of deltoid. At this plane, you can see the supraspinatus, not the trapezius. And here you can see the subcutaneous plane. Yes, please come. This is the subcutaneous plane, the dermis with the hairs. But at this point, you cannot see the trapezius. Now you see below the acromion there is a elaborated bursa. There is an elaborated bursa. Below that bursa there is the 3 muscles that makes the rotator cuff for the shoulder joint. That is number 1, supraspinatus, infraspinatus, and the teres minor. Bolo? Teres minor, yes, that is the teres minor, supraspinatus, infraspinatus, teres minor, and the subscapularis, isn't it? This one is the subscapularis, this one is the pectoralis major, all right, and this one is the teres major, and this one long head of triceps, long head, this one is long head of triceps. From the infraglenoid tubercle, all right, from the supraglenoid tubercle, the long head of biceps is entering. So there is a deficiency. Did you understand the relation? Could you understand the relation? Is there any struggle or doubt? Now you see, this is the coracoid process. This is the coracoid process from the margin of the, this is like this, from the margin of the glenoid, from the margin of the glenoid, coracoid process is like this. This is coracoid process. This has a base and a horizontal part. All the doubts are in relation to this. All right. The undersurface. Number one is the lateral margin of the root. Lateral margin of the root and the horizontal part. Another is medial margin of the root and the vertical part. All right. You can see here that these fibers are coming from the undersurface of the acromion process and going to be attached with the lateral margin, lateral border of the root and the horizontal part of the coracoid process. That makes the coracoacromial arch. That makes the coracoacromial arch. Confuse করবে না, মনে রাখবে এটা lateral lateral, ঠিক আছে, lateral margin আর upper surface আছে, ঠিক আছে, that is the coracoacromial arch. বোঝা গেল, পজিশনটা বোঝা গেল, এটা কোথায় আছে, ঠিক আছে। এটার আবার একটা ব্যাপার আছে, একটা কোয়াড্রাঙ্গুলার পার্ট আছে, একটা ট্রায়াঙ্গুলার পার্ট আছে, ঠিক আছে, অত কিছু দরকার নেই তোমাদের, এইটুকু মনে রাখলেই হয়ে যাবে, ঠিক আছে। আর in between the bands of glenohumeral ligament, in between the bands of, কালকে এঁকে দেবো, নেক্সট ক্লাসে এঁকে দেবো খুনি, ঠিক আছে। in between the bands of glenohumeral ligament there is a bursa which is mouth of the bursa which is known as Renbrecht foramen, foramen of Renbrecht. তোমাদের ওই নামটা মনে রাখতে হবে না, বাট মাউথ অফ আ বার্সা, সাবস্ক্যাপুলারিস বার্সা, এইটুকু কথা মনে রেখো বা লিখো, ঠিক আছে। হ্যাঁ, যে জয়েন্টের ক্যাপসুলে তো তিনটে ব্যান্ড রয়েছে গ্লেনোহিউমেরাল লিগামেন্টে, তো তার দুটো সুপিরিয়র ব্যান্ডটা from the glenoidal margin to the top of lesser tuberosity, the middle band from the glenoid margin to the inferior part of the lesser tubercle, and for the inferior glenohumeral ligament, this is from the margin glenoidal labrum margin to anatomical neck near the surgical neck, anatomical neck of the humerus near the medialmost area, that is the 3 bands of glenohumeral ligament. বোঝা গেল না, যায়নি। মিডিয়ালি কি আছে, গ্লিনোয়েডাল সারফেসটা এরকম করে, ঠিক আছে। এখানে কি আছে, হিউমেরাল হেড আছে, ঠিক আছে। এইখানে লেজার টিউবারসিটি আছে, তাহলে লেজার টিউবারসিটি থেকে একটা গেল, টপ থেকে একটা গেল সুপিরিয়র ব্যান্ড, লেজার টিউবারসিটির লোয়ার এন্ড থেকে আরেকটা গেল, দ্যাট ইজ দ্য মিডল ব্যান্ড, ঠিক আছে। আর এই যে অ্যানাটমিক্যাল নেকের যে মার্জিন, এটা যে মিডিয়াল এন্ড, ঠিক আছে, সেইখান থেকে আরেকটা গেল, সেটা হচ্ছে ইনফিরিয়র ব্যান্ড। হলো, ইনফিরিয়র আর মিডলটা, মিডল আর সুপিরিয়রের মাঝখানে একটা ফোরামেন আছে, যাকে ফোরামেন অফ রেনব্রেক্ট বলে, ঠিক আছে। নাও দিস subacromial bursa, শেষ হয়ে গেছে টাইম, হ্যাঁ। দি subacromial bursa makes another secondary socket for the humerus. We'll continue next day.